let's focus on the world of aviation. The airline industry collectively is expected to make losses of over $47 billion this year as the COVID-19 pandemic continues to weigh pretty heavily on the industry as a whole. That's according to the latest reports from the International Air Transport Association. Now, government-imposed travel restrictions do continue to dampen the strong underlying demand that the association does see for international travel. Now, despite that grim outlook, industry revenues are expected to go up by 23% to $458 billion compared to $372 billion generated in 2020. But remember, this year's number is just 55% of the over $830 billion in revenue generated before the pandemic. Airlines are expected to make significant losses this year because of challenges in containing new strains of coronavirus. Let's explore this in a bit more detail. Kamil Al Awadhi is the IATA Regional Vice President for Africa and the Middle East. He joins us now live from Amman in Jordan. Kamil, thank you very much for your time this evening. So let's start with a broad overview of the air travel market. According to the latest data from IATA, passenger traffic in March 67% lower worldwide compared to March last year. Cargo traffic, however, has had a very interesting rebound. But those are the global trends. How does passenger traffic and cargo traffic compare in Africa?
Thank you for having me. In terms of passenger demand, African Airlines traffic dropped by about 73% in March compared to what it was 2 years ago, which is also a deterioration from what it was in February this year. So air cargo obviously is improving in Africa, and African Airlines cargo demand in March increased by about 24% compared to the same month in 2019. So it's the strongest cargo recovery in the region. Robust expansion on the Asian-African trade lanes contributed to a strong growth in cargo. But in general, passengers unfortunately has dropped really, by over 73%.
Okay, so you've also made the argument for more support from governments to help their airlines to remain afloat. But wherever you look, Ethiopia, Kenya, South Africa, public balance sheets are really, really constrained. So what kind of support can these governments afford to offer?
Well, you have to understand that prior to the pandemic, aviation contributed to about $63 billion to the GDP of African economies and supported about 7.7 million jobs. Of course, the pandemic has negatively impacted over half of these important economic contributors, specifically about $32 billion in loss to GDP of African states. And it also puts about 5 million jobs at risk. So supporting aviation in general is essential for the African economy. With travel demand down by 76% globally, and let's say 70% for Africa, it's imperative to continue to support the industry financially. We must urgently activate the pledges of over $30 billion made by the African Union, as well as the African and international development institutions to support airlines and the wider industry.
In some countries like Kenya, just to follow up on that particular train of thought, in some countries like Kenya, we're seeing authorities considering giving tax breaks. I know there's a motion working its way through Parliament now to try and exempt Kenya Airways from paying corporate income tax. Are those some of the support measures you'd like to see more of across Africa?
There's many mechanisms that can be put in place by governments to support the aviation industry, whether it's tax or charges or levies, or just giving very low interest loans, whatever the case may be. Any support at this particular time is essential. It doesn't specifically have to be a specific type of financial support.
Okay, so what else needs to be done, though, in standardizing the other things that need to be done in helping people regain their confidence to travel amidst this pandemic, like standardizing COVID PCR tests, quarantine times, tracking and tracing? What are we not doing right in that field?
So we believe there are two specific aspects that need to be focused on. First of all, the harmonization and reduction of border protocols, including the cost of PCR tests. And the second one is the digitalization of traveler health credentials. So if we go to the first one. So harmonization of travel entry and exit requirements across the continent, including the cost and the validity, period of the PCR test is key for the restart of the aviation in Africa. Different protocols across the continent creates traveler confusion and continues to keep passenger traffic depressed. And most passengers don't want to travel because they actually are very confused on the requirements to leave one state and then enter the next. Also, the cost and types of tests remain restrictive. Okay, so with PCR tests being the standard test required by African states and costing between anything of $30 up to $150 per test across continents. And in some cases, if you want to travel from A to B, you will need a test before departure at A, and you will need a test at B, and you can see the costs going up here. The costs associated with PCR tests place African aviation at a significant disadvantage, and it's a fact. An increase of 10% of travel costs can reduce the demand at continental level by 15%.
Okay.
The other part that we need to focus on is digitization of travel health credentials. So today, if we don't put tools in place to manage the COVID-19 testing and vaccine requirements, such as IATA Travel Pass as an example, as more and more governments require verified testing and potentially vaccination proof as conditions for travel, digital health credentials are more secure and efficient at airports specifically than the current paper processes used to manage health requirements. Okay, so we're working with the African Union and the CDC to synergize these digital platforms for travel health credentials and border requirements.
Is it part of the problem here that you've got all these different platforms that are dealing with health credentials? Because when I've done tests here, I've seen my details uploaded to a specific database, but then IATA has got its own. I mean, there are all these different databases that exist at the moment, but are they talking to each other?
Absolutely. So this is an issue we're facing right now, where we have a number of requirements to travel from A to B, and it sometimes could be 3 or 4 separate applications downloaded and the same repetitive information being entered at with the same data before you're allowed to travel. And unfortunately, there isn't any interlink or connection between them. And this is why IATA has developed the IATA Travel Pass. It is trying to be a one-stop solution for the digitized requirements of transfer of documentation from one state to another in a very safe and efficient manner.
Okay, one last question for you. I'm trying to look for silver lining here, but given the fact that demand for travel has dropped off so significantly, I mean, this does seem like a prime opportunity to try and lower the barriers to air travel within the continent as a means of spurring the recovery of the aviation sector, doesn't it?
Absolutely. So I think you've hit the nail on the head. If you look at the recovery right now, it is very much domestic recovery around the world. And of course, this is not new to IATA, and we are working with the African Union to have the single African air transport market, or SATM. Of course, SATM is a key factor in determining the speed at which the African aviation industry will recover, because then you do have domestic travel, and it means that you have better connectivity and a faster recovery. So far, about 35 African countries have signed up to SATM, representing about 75% of the African passenger traffic. However, only 10 states have fully implemented the SATM measures. Additionally, we're trying to call on governments to reduce these taxes, charges, and other costs that make flying too expensive right now during the COVID.
Indeed. We'll leave it there for the time being. Kamil Al Awadhi, IATA Regional Vice President for Africa and the Middle East, thank you for your time.